We are back on MorningLine. Thanks for joining us. Dr. Dennis McCleod is joining us from Vanderbilt, a psychologist there dealing with behavioral health and taking your phone calls. How are you feeling this morning? How do you sometimes deal with mood swings if you have them, especially when they tend to hit maybe in the coldest days of winter and the like, when we don't have as much daylight as the day. It really sucks when it gets dark at like 4:30, 5 o'clock. Finally now, of course, we're past the winter solstice and days are getting longer, and that helps. Doctor, when we went to the break, we were kind of just talking about comfort things that you can do, and we talk about supplements, and we're going to talk a little bit about counseling and maybe also medications in severe cases that can make a difference for folks. But sometimes for me, and I try to watch what I eat, and I'm cautious with certain things I do, but if I'm feeling blue and I'm driving home, I will drive through McDonald's and get a darn Big Mac. And I love Big Macs and I have nothing against them. I just don't eat them that often. But I will eat it, and I will tell you, 10 minutes after I've ingested that burger with special sauce, 2 all-beef patties, I am feeling better. And I'm not sure why. Because it's hardening my arteries at the same time. What do you think?
Nick, that's great. I think that, so there are some connections, right, actually between the reward center in the brain and also like food, right, what we put in our mouths.
Yeah.
And so one of the struggles, right, managing your weight and also managing your mood, right? Especially in the South, right? I grew up in the South myself.
Sure.
And so every celebration was connected to some type of food, right? And so that's kind of hardwired into us as well, that positive things happen when we put delicious food in our mouths. And so trying to really separate those two can be really difficult. You said something that was so important, moderation. Not the word you use, but definitely you said, I do it once in a while. And so moderation is really the operative word here. Like, how in the world can I get my Big Mac once in a while, as opposed to it becoming the source of my happiness? Right? When I'm not feeling well, I automatically go to the Big Mac, or automatically go to the cigarette, or automatically go to the bottle, whatever the thing is. So making sure that those things are moderate. And if they're not, right, if we can't decide one day to not have the Big Mac and still be okay, find other ways of getting support, right? So friends, family, like you mentioned, medication, therapy. There are lots more ways for us to get through the blues. The problem becomes when one of those things is the only way that we're able to get out.
So with medications, are there medications that someone can be put on? Let's say they're not diagnosed, manic depressive or bipolar, but they say, look, doc, during the winter months, especially January and February, it just kind of hits me a bit and I feel blue. And it's a little worse. It's to the point where I think I need some kind of medicine because it's really, really affecting my ability to get out of bed in the morning. Are there medications that can be prescribed that it's not something that you're going to take regularly or year-round, but just to help you through that difficult time? Or perhaps someone like Ann, I don't know, if you're having some other events in your life that have really kind of triggered the depression, aside from just the time of year, can you take medications, short-term, pills, just to get you through that tough time?
Yeah, again, another great question. I think that the main, so the short answer to your question is absolutely. There are definitely medications that we can take short term, but we also think the same thing, that therapy is something else that I really prescribe for folks short term. I'm able to have folks who oftentimes pop in response to some difficult struggle, and we know that the best treatment for mental health issues, both therapy and medication. So if there's some issues that you're having maybe first come in to talk to your primary care doctor, maybe even a mental health professional, they can do a screener. And then that's where they start with, are your symptoms enough? Are you struggling enough where we need to be thinking about intervention or treatment plan? What we do with that information. Go ahead.
I'm sorry. When you said treatment plan, what kind of medicines are there? I mean, we've all heard the different things like Prozac, or what is being prescribed these days for folks in this situation? What type of drugs?
Mm-hmm. So there's a wide array, again, as we mentioned before, that people are different, right? Some folks might benefit more from Prozac, other folks from Wellbutrin, other types of medications. There are different receptors we have in the brain. All that means is, there are different medications that work better for some folks than others. And so sometimes it does take some time for your body to get acclimated to the medication that you're taking. In a similar way, it might take some time for you to get acclimated to the therapist that you're seeing as well. So I really do think that doing both can be really helpful. And then again, even during a short amount of time, so that maybe during the winter months, you notice my depression's a little bit worse. I want to get in and see someone. You spend a few months with that person, and then you assess, right? I'm assessing almost every month, every patient I have. Hey, how you doing? Do we need to change your treatment plan?
How do you feel about Seroquel?
I think it's a good medication depending on the individual, right? Again, as not being a prescriber, all of my patients are not on Seroquel.
Yeah.
But I do have some patients who do use that medication and who have benefit. Others who tried it, hasn't worked for them, so they've tried something different.
Varies, I got you. Another part of this, and you're right, therapy, very important component on this. Things like, what do you think about meditation, yoga, things like this? And I guess even beyond that, just general exercise, and sometimes in the winter months when it gets so cold, especially if you like to do so outside, it limits your ability to get out and about. But, things like meditation and yoga, they can play a role as well? I assume the answer is yes.
Oh yeah, absolutely. So mindfulness is really the word I use, the umbrella term for all of those things you're describing: meditation, yoga, tai chi, qigong, a bunch of cool things that involve moving the body, maybe even moving the mind in a way that really kind of sharpens our ability to pay attention, both to the bad and to the good, right? To be able to move the attention around in a really expert way, so that we're not reacting to some of the stressors that we normally have, and instead we're able to respond in a pretty adept. So I think that doing so can be really, really helpful, using mindfulness, using meditation to manage some of your mood. In fact, it's something that I try to do every day if at all possible. And then to your point around exercise, I think exercise is extremely important for managing mood, for managing weight, for managing your brain, all that stuff. And moving those activities indoors has been hard for me, can be hard for folks, because I'm used to running outside,
right.
And now I've been on the treadmill for months, and the treadmill is not nearly as fun as the beautiful scenery in Nashville.
Yeah, exactly. When you have that issue, you can't get out, you're feeling blue, and maybe some folks don't know where to start, which is why we're doing the show today. But it's true, too, this time of year, I'm guessing we see a spike in the number of cases of self-medications. And I'm talking about people that maybe turn to drugs or end up drinking a little bit more in excess. And you hear that there are, super high alcoholism rates in various states that do not have, a lot of sunlight, and they're very cold a lot. I hear about that in places like Montana and Alaska. And I don't know, I assume those are connected in some way. And we see, substance abuse spiking this time of year.
Yeah, makes a lot of sense. The word that comes to mind for me, I used to do some substance use treatment, and one of the words that I use is creativity. Right? How can we remain creative, remain open-minded in the ways in which we manage stress? In other words, instead of assuming that we're going to get to a place where there's no stress, right, where we don't have any issues at all, instead, okay, I'm going to have stress in the future. What are the 20 things that I can do to manage the stress? Because when the gym is closed and it's cold outside, right, and I've got a bottle at home and my wife is away,
right.
Then what am I going to do to manage my stress? Well, we got to stay creative, right? Is there a phone call I can make, especially in the light of COVID, right? Can I Zoom or FaceTime or, WhatsApp one of my friends or family members I haven't seen in a while? Staying creative is more hard, right? But it's also more important.
Yeah, it's interesting. Just speaking from personal experience, sometimes when you find yourself alone or you just don't feel motivated to get up and about, and you're not sure you should, and then you force yourself into it. You decide, I'm going to go down and volunteer today at the animal shelter even though I don't feel like it, or I'm going to go down to the mission, volunteer work, or I'm just going to go, shoot some hoops at the gym. It's just amazing how you didn't anticipate the way you would feel later, but once you get into it, all of a sudden you start feeling better. And prior to you showing up and literally forcing yourself to go, you were like, this is a mistake. I don't want to do this. But I'm just going to force myself against my better judgment. And then you get there, and all of a sudden there's like a part of you that awakens that you didn't really know was there, and you start feeling better.
Yeah, absolutely. You said against my better judgment. Yeah. And I know when I'm feeling down or blue, it's for me, it's the opposite, right? That's not my better judgment because I'm feeling blue.
Yeah.
Right. And so maybe what I'm instead is I kind of have this joke. I say I don't trust myself when I'm feeling down. Right. So feeling down and my brain's telling me, oh, stop and don't move anything. No, Dennis, get up, right? Go do something, get moving. So I think it's really important to kind of be aware, like, how am I feeling right now? Am I in a season of kind of darkness or blueness or not feeling so great? And if so, like, how can I kind of change the environment around me to support me, as opposed to, kind of do something that will have ramifications or have some struggles in the future.
Do you think most people, when they feel down in the dumps, know why they feel down in the dumps? Or do they just feel that way and they're not sure why?
Yeah, I think more often than not, at least in my experience, clinically, personally, this stuff comes out of nowhere because we're having, think about your eyes, right? When I'm walking through the world, there's so much information I'm taking in and I'm trying to filter through that information, but it's still getting in, right? I'm just filtering it. And I think our life, our mood is the same way, right? There could be, something I was in Lowe's the other day. I remember, not even noticing when I left why I didn't feel great. Well, my dad and I used to always visit Lowe's together, right? And I miss him.
Yeah.
And so I think that those type of things kind of collect in the body, collect in the mind. And so, as a result, we end up trying to, figure out, well, what's wrong? And sometimes we can get distracted with, trying to figure out what is the exact reason, as opposed to treating the symptom. I'm feeling down, so what do I need when I feel down? Instead of focusing on why do I feel down, because that can really take up a lot of your mental energy and then honestly in some ways make you feel worse.
Yeah, it's a good point. Regardless of, I suppose, the reason you're feeling bad, and so address it. Listen, we'll take a quick break. When we come back in our final segment, just want to kind of break it down to the real nuts and bolts. If there's someone out there watching right now that's feeling bad, has not dealt with it before, and just talk step by step, tangibly, like you're talking to someone. What's the first thing they do when they get done watching this show if they want to start seeking ways to start feeling better? We'll see what the good doctor has to say about that in our final segment right after this. Stay with us.